We're here to talk about earthquakes today, and there's been a few. There's been a few big ones, but there's been another 10,000. So we're not talking about a earthquake, we're talking about lots of them. And you can check this on your smartphone, as the taxi driver showed me yesterday. I'm not sure about that as a healthy strategy of constantly, 10,000 checks of earthquakes probably isn't doing anyone any good. But they're coming, and they're still coming. And I stood up a year ago and said that other places that we knew had earthquakes, probably the closest that we knew about was Turkey in the late 90s. I don't know if people know this, but the biggest earthquake of the 20th century was in Turkey. And there was a lot of death and destruction. Some 10,000 people died and 50,000 seriously injured, mainly because their buildings weren't as good as ours in Christchurch. But they suffered aftershocks for the next 5 years. Most people sort of, when they hear that, well, we heard it again now, oh dear. But we are in a shake zone, and you experience those on a daily basis. We'll keep coming back to Turkey because they've done quite a lot of work with people, but I wanted to switch from the red of the Heart Foundation to the blue of the brain, and talk about your brain today, and talk about the science and the physiology of your brain and your body and what it does when it's under threat. So just think back, you know what happens, you come out of your cave as a prehistoric human, and you look around, and just out of the corner of your eye you spot a saber-toothed tiger, and there's a very quick response before you have time to think. Does anyone remember what that was called? Fight or flight, yeah, down the back, that's good. Actually, usually at the university there's a linear relationship between how close you are to the front and your final grade, such that the best students are sitting closest to the front, so that's these guys. And I often notice that the front seats are empty in some of my classes. But it's good to hear the answers coming at the back. So it's this fight or flight response where your body, when it senses danger, before you have time to think, there's an automatic reaction. It's in a more primitive part of the brain, in the midbrain. And this midbrain lights up, it sends off adrenaline, which gets your heart going. The heart then starts to shunt blood to your arms and legs, and you might stay and fight. That's not my preference. Or you might run away. That's certainly my preference. One way or the other, this is a really good response. It's an adaptation to acute danger, and that acute danger is probably over with reasonably quickly. One way or the other. You stay, you go, you live, you die. Something else happens in the brain which is useful to know about, is that you take on some attributes which are also good in this situation. You become pessimistic. You start to overgeneralise. It might be some other type of harmless prehistoric cat, but let's just assume it's a dangerous one. You reduce your working memory so you can concentrate on more of a tunnel vision, single things, staying or going. And you become emotional. That might be anger if you're staying, or fear if you're going. And you can see in this situation that's good. We have the same situation when there's any sort of other event that we might perceive as being dangerous, and it goes off pretty quickly. So any aftershock is going to set off the same response. And first of all, that's a good thing. If this didn't go off in an aftershock, then you'd have cause that your physiology wasn't normal and you weren't responding like a normal human. So the first thing about aftershocks and the stress response is that's entirely normal. Before you have time to think, you'll have adrenaline dumped into your system, your heart rate will go up, you'll become slightly pessimistic, emotional, overgeneralising, and a little bit focused. And those are all good things, you can see. The trick is, when it goes off 10,000 times, it can possibly wear you down a little. And the Turks were the first to notice this and do the scientific study of how people responded for these aftershocks, and what they noticed were two things. This is normal physiology, and you can turn it off. So the first things to do, and I think this is probably the most important thing I will say today, there's a really nice technique for turning off this stress response. The first is, and it's a two-stage technique, the first is to say, yes, this is a normal response to something that's happening in the world. I'm normal. The second is, it just turns out that there's a thing in the body called the barrow reflex. It's a natural part of our physiology that connects to our heart and our brain. And it turns out if you breathe in slowly and deeply, you let your tummy go out when you breathe in, and you breathe out even slightly more slowly, it's impossible to have that stress response at the same time. You breathe in slowly, let your tummy go out, breathe out even more slowly, you invoke the barrow reflex, you turn off the stress response, and you're back to normal physiology. Some of you might recall, or I certainly recall, my grandmother saying to me, when you get a bit head up, darling, before you say anything, take a few deep breaths, count to 10, then say what you want. Did anyone's grandmother say that to them? Some of you may be grandparents and you can say that to your grandchildren. When my grandmother said that, what she really meant was, look, darling, if you take a few deep breaths, you'll be able to turn your emotional, pessimistic midbrain off. You'll put your frontal, rational lobes of your brain in control, and you may say something sensible which you won't regret. And that's why, if you're at work or someone says something ridiculous, taking that time to get the rational brain in control is a very good thing. But the same principle applies, especially if you're waking up in the middle of the night by an earthquake. You're going to have this adrenaline dumped into your system. You're a bit activated. I don't know if people have had trouble getting back to sleep, but this is a great way to go. We might just do a little bit of practice on that now. So what you do is you put your hand on your tummy and you feel when you breathe, we'll just wait for the next one in, but you breathe in and you feel your tummy go out, and you breathe out just more slowly. Do a couple more. Now if anyone's ever done yoga, meditation or Tai Chi or prepared for a martial arts battle, and a lot of sport people do this as well, one way of focusing yourself and calming yourself down is to take some slow, deep breaths. This is just the science behind that. And so what the Turks found is that some people naturally did this anyway, but for the rest of us, it's a very easy, learnable thing. Slow, easy breathing in, slower breathing out. And there's a great physiology behind that for settling yourself down. And we'll come back to that again in sleep in a moment. I just want to talk about a couple of other parts of the brain in relation to what we're talking about, and stress and resilience and responding. And I call these brain rules. I've got 3 of them. Brain rule number 1 is that your brain responds well to moving. Physical exercise helps in virtually every part of your brain and body. I've put an acronym up there, GOYA. Can anyone guess what that stands for? Get off your ass. Oh, you did, right. This is why he's up the front. A+. It is get off your ass. So it's the get off your ass principle. So any movement is good movement. Your brain responds well to standing, to walking, to everyday activities, including shopping and gardening. So all of those things are a great thing for your brain, but more importantly, it helps modulate these day-to-day stress responses and whatnot. If exercise came in a pill, it would simply be the best medicine. Exercise is medicine, in fact. While we're here and talking about exercise, it would be remiss of me not to talk about food. I'm not sure if this is Heart Foundation policy, but my take on healthy eating is simply this. If it rots in 3 days, I don't want to bring up my grandparents again, but if my grandmother would have recognised it as food, or if it rots in 3 days, then you can probably eat it. So we're talking about actual food, real food. If it doesn't rot in 3 days and your grandmother doesn't recognise it, then it's what you call an edible food-like substance. And you can eat those from time to time, but they're not actual food. So I think, that's just a great way to go. What I want to spend the last part of this on mostly is sleeping. I don't want to put up a complicated graph, but this is how your brain changes in activity across this 24-hour cycle that we all live in. It's called a circadian rhythm. It turns out that sleeping at night is pretty good for you. In fact, it's an essential part of rejuvenation and having a healthy and happy life and coping on a day-to-day basis, as I'm sure you all know. And what you notice is that the brain comes in and out of being active during the night. So it has these very deep, motionless sleep periods at the start of the night, and then it cycles in and out of these more active dream sleeping phases. And we notice a few things, that if you're constantly woken, and this could happen because of the odd aftershock, could happen because you're stressed out, could happen because you snore a lot or you happen to be near snorers, it could happen because you're drinking to get to sleep, it could happen because you're using sleeping pills beyond just a short-term remedy, then you don't end up getting this deep sleep. And this deep sleep is where our brain particularly rejuvenates. It's where we grow new neurons at any age. We can grow new brain cells. And where we change the connections between brain cells, which is how we learn new things. So when you start to miss out on that sort of deep sleep, memory becomes a problem for us. So remembering things, making new memories. Equally, if you don't get this dream sleep, then it's not memory that you suffer from, but it's solving problems. And a continuous sleep is part of getting in and out of this dream sleep and into this deep sleep. Tips for sleeping. I'm sure we'll talk more about sleeping pills later, but if you haven't slept for days on end, then that could be a very short-term solution, but in the long term, a more natural solution is good. We're all going to sleep less as we get older, but we should all have a reasonable quality of sleep. Tips. Some of these are obvious, I think. Getting up and going to bed at the same bedtime. Avoiding bright flickering light before you go to bed, especially in your bedroom. Can anyone think of a source of bright flickering light in their... yeah, that's right. Oh, we'll come to alarm clocks as well. So those are routine. TVs in bedrooms particularly are known to be associated with a poor night's sleep. The idea is to get yourself in the right physiological state for sleeping, and that involves blood starting to come into the central area and moving away from the arms and the legs. And you'll assist that naturally by, I imagine most of you hang your feet and arms occasionally out the side of your blankets and duvets. But also exercise a few hours before bed helps generate that physiology. A hot bath in the hour before bed can help generate that same physiology to start to get the blood coming and pooling in the central organs and feeling sleepy. The other thing, someone mentioned alarm clocks, and I had an alarm clock. I found an alternative use for it. I ran it over on the driveway. And I did that because I think, particularly in Christchurch, those luminescent digital alarm clocks can really haunt people in the middle of the night. You get woken up by an aftershock, it's 3:03. You know this, don't you? You look at it, you sit around for what seems like 2 hours and it's 3:16. And they can really haunt you. So if you must have an alarm clock, put it down the side of the bed or something, and where you don't have to constantly look at it. Alternatively, I just ran mine over, and that was the end of it. And if that doesn't work, the last thing I suggest, it's okay to get up, but if you start to switch on a lot of bright light, you change your physiology a bit. I personally like to listen to things, and I have my little iPod, and I can download shows from the BBC Radio in the UK and ABC Radio in Australia and Radio National. It's all very good. You put on the British Medical Journal podcast, will send me to sleep in 2 seconds flat, I guarantee it. So you can try that, you might learn something, or you might just go back to sleep. Either's good. Sleep. So we can come back and talk about that a bit later. Just one final note on snoring. The people that I've worked with and talked to that have been heavy snorers, there are a variety of solutions that can help sort that out. It could be a nasal blockage, it could be a matter of losing a few kilos, and there's more more long-term interventions, these continuous airway pressure devices that sit across a little mask when you go to sleep. I don't know if people use those, but they really can change your daytime life back to feeling normal if you're not sleeping well. Okay, we'll leave it at that. Thanks for listening to me. I'll hand over to Lucy, who's going to talk to you about a whole bunch of really exciting stuff. Oh, I need to...
I want to start by saying thank you for coming along today. I particularly appreciate the effort you have put in to be here, and I say that because my day job entails me reading lots of research papers. Are you just going to do that for me? So I read research papers on the psychology of well-being all day long and what does and doesn't contribute to your well-being. And a common finding that I read about is that making an effort is what well-being requires, that we make an effort. And so it's not something that you can ever really take for granted or overlook, but it is the activities that we choose to do and the way that we choose to think that are the biggest contributors to your resilience and your well-being. So I applaud you for choosing to be here with us all this morning. Now I'm going to talk to you about mental health, and I've put together for you a survival toolkit for 2012. But before I actually get into that, I just want to say that when I talk about mental health, I hope you haven't come along to hear me talk about depression and anxiety, because I really am going to talk to you about health. And so for too long, psychology has just talked about mental health, but actually meant mental illness. And what they have done is always just look at how to identify and treat mental illnesses. But for too long, the profession of psychology neglected to look at the elements of well-being. And over the last 15 years, psychology has taken a different tack, and now we do know a lot more about what does constitute well-being. So that's what I'm going to talk to you about today. Now the good news is that we are all remarkably resilient. The research shows that while you might not be feeling resilient every day at the moment, and has anyone heard that phrase about the honeymoon phase being over? Do you feel like it was a honeymoon? But what all the recovery experts say is that we go through these different phases in response to trauma. And the first one is that honeymoon phase, where you do have the adrenaline, you do have the energy to get out and help your neighbours. And then that wears off. And now we're into, unfortunately, the long kind of war of attrition. And so this year, in particular, I urge you to look after yourself and really focus on your well-being, because now is let's call it some kind of endurance event really, and we are going to find it tiring, but there are very simple strategies and tips that I'm going to give you today that will make a huge difference in how you get through that year. So here are my 6 tips, and I'll just read them first and then I'm going to talk you through them one by one. So the first one is that you need to invest time and energy in your relationships. The second is you need to get out of the house. Third is that you need to do something active every day, do what you love, give to others, and make an effort to tune into the good stuff. So, like I say, these are just tips and strategies. I don't want you to think that I'm preaching to you and that you've got to tick all these off every single day, because that will sound exhausting and totally terrifying in itself. But if you just start to, as I talk about these, think about how you can weave them into your own lives, that will give you extra stamina. So the first one is that you need to invest time and energy into relationships. The standout finding of resilience research is that nobody makes it on their own. So if I asked you how many of you have met new neighbours as a result of the earthquakes, can you put up your hand? So one small good thing has come out of what we've gone through in the last year, and now I would say to you, keep looking after each other, maintain those friendships and relationships. If you work and you've got good friendships at home, but you tend to find yourself more isolated at the weekends, then set about thinking how you could find activities to do that involved other people at the weekends, but just try and avoid that really isolating loneliness, because that makes life just so much harder when you're faced with these continual struggles that we have. When you're fighting your battles with EQC, EQR, the insurance companies, and you're watching neighbours pack up and leave, that's tough times. So you need people that you can rely on to be there for you. You need to have people who will listen to you, and you need to listen to other people. So that goes back to sort of actively listening again, choosing to spend some time listening to your neighbour. Not telling them what to do, and not telling them your woes, but actually just perhaps saying to them, hey, what can I do to help? Or what do you think might make that better? So asking them questions and helping them find the answers themselves. So, like I say, relationships are core, at the very core of our well-being. Now, the second one is just get out of the house. And this applies, there's the area of psychological research that looks into the benefits of going outdoors is actually a very new field. And we don't know that much yet about the mechanisms and why it makes such a difference. But I think we all intuitively know that getting out helps us. And I think right now, more so than ever, if your house is not looking its sharpest, and if it's the house that is the source of your frustrations, then it's a really good idea to just get away from it and give yourself a break. So combining that with the third one is to try and weave activity, physical activity, into your daily lives. Now, who's heard that recommendation before? Pretty much everyone? It's easy to say it, not quite so easy to do it, is it? So I think we all have to develop strategies to help us be more active. And personally for me, I like to think, I have to plan. So I know that if I leave the sort of choice up to me, then it's all too easy to get through the day not getting out, not doing anything active. So I like to try and think the night before, okay, what am I doing tomorrow? Where am I going to be? Maybe I could arrange to meet a friend for coffee at lunchtime, and we'll choose a coffee shop that's halfway between her house and mine, and that means that I know I'm going to walk there. And then I might send someone a text on a Sunday night saying, do you want to run on Monday morning? No, nor do I. But probably for my heart health and my brain health, I know that I need to get out there, so why don't we meet, And so I set up these appointments. So I call it the who, what, where, and when of exercise. And please, I know this isn't easy. I know it's really easy to say it, but if you all work out perhaps what the barriers are that come between you and being active, write them down, and then work out ways of actually getting over those barriers. Because, like Grant said, exercise really is medicine. It's pretty much the single most effective thing you can do for your mental and physical health. Just as important for your mental health as it is for your physical health. So number 4 is do what you love. Now some of us we kind of neglect the things that we love, and we don't know what we love any longer. So if that applies to you, then just the next time you've got a cup of tea and you're sitting at home alone, get a pen and paper and just remind yourself, what are the things that really make you laugh and give you joy? Because for me to tell you that you're going to need joy and laughter in the year ahead might seem really flippant when you've got so many more pressing, frustrating concerns. But there's a huge amount of research that shows that we need positive emotions for resilience. Just before 9/11, they had done a research project at one of the big American universities, and they had measured the participants in this study. They'd measured their positive emotion levels prior to 9/11. Now, after the terrorist attacks, they went back and they measured them again on resilience, and they found that the people who were most resilient were the people who had experienced the highest positive emotions in this month period prior to 9/11. So I won't go into the actual mechanics, they are really well known and science does understand that now, but positive emotions sort of open us up and they make us make new friends, and we reach out and we try new experiences, and for lots of different reasons they broaden and build our psychological capacity. So very important then. I don't know what the things you love are, but just as I say, write them down and try and weave those into your life. So then we've got giving to others. We talk about sort of two types of giving. One is I'd encourage you to perhaps put some random acts of kindness into your life. So you might just turn up on a friend's doorstep with a cup of coffee and say, let's get out and go for a walk. Or you might instead decide to give your time, your energy and your skills, perhaps volunteering. Or I was recently talking to a retired businessman who's now approached I think it's the Canterbury Development Corporation, who are offering mentorship. So there's lots of different ways. We all know there's lots of different ways that you can give. And I think the Student Volunteer Army was a perfect example of that actually giving gives back to you. So it's definitely a great way to deliver and kind of boost your well-being. And then finally, I've got what I call tuning into the good stuff. And I've put in brackets here TGT, which stands for 3 good things. So this is just a neat little exercise that you can do, that you can lie in bed at the end of the day, and you're meant to write them down, and I never bother writing them down because I never had a pen and paper there. But I just lie in bed thinking, okay, what good things did happen to me today? So they can be really small things. They don't need to be, absolutely, I got back into my house. But they can be, mine for yesterday was that we started on a foul, hideous, cold, wet winter's day. And actually by the end of the day, the sun had come out. So we're just trying to tune ourselves into the good stuff around us, because as humans we have this negativity bias that we notice the bad very easily. We talk to each other and we seem to share our good news quite often more readily than, the bad news more readily than the good news. And so just by making that little mental note at the end of the day to think about what went well today, will just shift away from that negativity bias and make you start to understand that there is some good stuff happening in Christchurch. I mean, if you just read the paper alone, it's enough to make you want to sink some days. So put the paper away, go and talk to your friends, share your good news, and seek it out yourselves. So as I say, this is a long list really, and I really don't want to be preaching to you, but the Mental Health Foundation, if you look at the posters around the room here, they are echoing the strategies that I'm talking about here. So if you forget what I said, then keep an eye on the posters later on. Thanks, guys.
I'm often asked by my patients, and I'm sure Simon as well, how much stress plays a part in their heart disease. It's a very difficult question to answer. Stress is thought to be an independent risk factor, but we know a lot more about the other risk factors for heart disease, and it's very difficult to know how much of a part stress has played. But it's been well demonstrated that after sort of significant natural disasters, such as the earthquakes that we have had, the number of patients with heart attacks and also the incidence of sudden death increases. And there's some evidence to suggest that this increase in heart disease and things is sustained for a number of years after the event. So what's happened in Christchurch following the earthquakes? Certainly after the September and February earthquakes, we noticed a significant number of increase in admissions. We usually get about 80 admissions a week in the cardiology unit, and following each of these major earthquakes, the numbers increased to around 120. But interesting to know that after the subsequently in the other major earthquakes, we didn't have a sort of surge in admissions, and our numbers have stayed fairly constant ongoing since the earthquake. But we think we're only seeing the minority of patients. Undoubtedly, a number of patients have left the city, and patients are suffering at home and being well cared for by their GPs. So we're certainly not seeing all the patients out there with heart disease. Hopefully we're seeing the most significant heart problems. So it's very important that patients are aware of what are the typical symptoms of heart disease, because undoubtedly and unfortunately many deaths due to heart disease are premature and are avoidable if the diagnosis was made earlier. The classical symptoms of heart disease is pretty easy to recognise. You sort of get a dull discomfort in the chest that patients invariably describe as a heaviness in the chest, or sort of like an elephant sitting on the chest, or a constriction band around the chest that can go down the arm, normally the left arm, or into the neck. That is sort of the classic heart disease pain of angina or a heart attack. It can be quite subtle, it doesn't have to be severe, but that is a typical symptom. Normally comes on with exertion initially, but then can happen at rest. The majority of patients present with those sort of symptoms, but it's a small minority of patients, well probably a large minority of patients present with atypical symptoms. And atypical symptoms can mimic asthma or indigestion or skeletal sort of type pains, muscular pains, and they're much harder to recognise for the patient and also for the doctors. So it's very important that if you are having any chest symptoms, that you discuss your symptoms with your doctor, and because it's certainly not uncommon for patients to present to the hospital with a heart attack and tell us that they've been having asthma or indigestion for the last 6 months, when it's actually been their angina. So what is angina? Angina is essentially heart pain, and the reason why that occurs is because the heart's not getting enough blood supply or enough oxygen. So the heart's basically a ball of muscle the size of your fist that's designed to pump the blood around the body, and it also needs its own blood supply to work. And the coronary arteries run on the surface of the heart, and they supply the heart muscle the blood that it needs. But the coronary arteries are very predisposed to developing atherosclerosis, which is sort of fatty plaque buildup in the arteries. And this happens slowly over a number of years. And once the plaque build-up gets to a critical stage, once the arteries are narrowed to a critical stage, then that's when people start to get symptoms. And the symptoms happen initially on exertion, because the heart has to work harder when you exert yourself, and you can't get the required blood supply past the narrowings that you require. So a heart attack occurs when there's a sudden blockage in the artery, and these blockages normally happen when the plaque cap ruptures and you get a sudden clot formation, blocking the artery completely. And depending on where that blockage is in the artery depends on how big and how significant that heart attack is. So the muscle downstream of that blockage, if you don't get prompt treatment and if you don't open up the artery promptly, the muscle downstream from that blockage will essentially die. So this may not project very well, but basically this is the first patient who came in with a large heart attack after the February earthquake. You can see they came in at 11:30 at night, and the best treatment for a large heart attack is to try and open the artery straight away. And we do that by taking them to sort of the cath lab, which is like an operating theatre, and we go up with catheters to the heart and put wires down the artery, wires in a balloon and a stent, and try and open up the artery. And if you can see this here, this artery is completely blocked here, and then after we put a stent in, this whole artery opens up again. And so this would have been a very significant, potentially non-survivable heart attack if we don't get prompt treatment and have the artery opened up. This is just an example of what a stent looks like. So it's a sort of a wire lattice, it's not a solid coil, and the stent goes in, it comes mounted on a balloon, and the balloon is deployed in the artery, sort of impregnating the stent into the wall. And then your artery sort of heals around the stent and it gets impregnated into the wall. So what can be done to lower your risk of heart disease and to prevent future events? If you already have established heart disease, it's very important to take prescribed treatment. As doctors, we sort of assume good compliance, but we know that's not, in reality, that's not always the case. The medications that we prescribe for heart disease, once you've been diagnosed with heart disease, are very effective in preventing recurrent events. There's very good evidence for them. But we're aware that there are a number of potential side effects, so you should discuss potential side effects with your doctor rather than stopping the medications. Generally, most of these medications are prescribed indefinitely. I say indefinitely because there might be better things that come along. But these medications are designed to continue and not be stopped after 3 months. We often don't explain that well enough to patients. We give someone a prescription when they leave hospital and for 3 months, and then they may stop it after 3 months, not realising they're supposed to see their GP for ongoing prescription. In addition to the medications, it's also very important to make the necessary lifestyle changes, and we'll mention those again in a minute. Cardiac rehabilitation, excellent programs are available, run by a variety of health experts, and they're the best situation to get the advice about heart disease and ongoing management of your heart disease. Once you've got heart disease, you've always got it. You probably always require treatment for it, but modern treatment's very good. There's no reason why you can't live a long life with heart disease. What about people without heart disease? The Ministry of Health and New Zealand guidelines recommend that all men by the age of 45 and women by age 55 have a cardiovascular risk assessment. And that should be done earlier for if you're at significant increased risk, meaning if you have a family history of vascular disease or cardiovascular disease. And that's usually, we talk about family history being significant if you've got a male first degree relative having an event or being diagnosed with heart disease before the age of 55, or a female relative before the age of 65. Or if you're already a smoker or a diabetic or got high blood pressure or very high cholesterol before these ages, you should have your cardiovascular risk assessment earlier. And your GP should be your first point of call for your cardiovascular risk assessment. They have these charts available to them, and they're the New Zealand cardiovascular risk charts. And what they do, they estimate your risk for the next 5 years. This is a risk of a heart event or a stroke. It's all cardiovascular disease, and they just need to know your age, your blood pressure, your cholesterol, whether you're a diabetic or not, whether you smoke, and they can plug these figures in and get your estimated risk. And according to your estimated risk is how they treat you, whether it's just with lifestyle changes or whether you need treatment, pharmacological treatment. Likewise, the Heart Foundation has a very good website called Know Your Numbers. If you know your blood pressure, if you know your cholesterol, I think particularly if you have got heart disease, these are numbers that you should know, and you should empower yourself and know what's happening with your risk factors. And if you need to know your weight in kilograms and your height in meters, and you can work out your body mass index, and you can plug these numbers into this website, and you can get another assessment of your cardiovascular risk. And I'm told that the good thing about this website is that you can make targets, and if you can see what happens for your risk. If you lower your blood pressure or you lower your cholesterol and you lower your weight, you make these improvements, you can see how much your risk decreases. So it's certainly worthwhile. So what are the risk factors for heart disease? Unfortunately, we can't do anything about our age, ethnicity or family history. They're the sort of non-modifiable risk factors. But we can certainly do something about the modifiable risk factors. So smoking, physical inactivity, obesity, high blood pressure, high cholesterol, and diabetes. So obviously complete smoking cessation is recommended, and also avoidance of environmental or secondary tobacco smoke. Physical activity, the green prescription recommends 30 minutes of physical activity, as much as you can do, at least 5 days a week. That's at a minimum. Weight management is obviously very important. We mentioned the body mass index. That's the ideal body mass index. Obviously very difficult to achieve for certain people, but it's certainly a target that's worthwhile. Blood pressure control is very important. Hopefully everybody in this room has a blood pressure of less than 140/90. That's unlikely, but you should ask your GP or the practice nurse when they take your blood pressure what your blood pressure is. And so I think these are numbers that you should know. If you've got heart disease, if you've got diabetes, or you've got renal or kidney disease, then ideally your blood pressure should be less than 130/80. These figures have been shown to be very important because as your blood pressure creeps up above these values, we know that your risk for stroke and heart attack long term has increased significantly. So people may require 2, 3, 4 different medications for their blood pressure. What's important is that they tolerate the medications and that your blood pressure is brought down into these normal ranges. Cholesterol or lipid management is also very important. If you have established heart disease, especially if you've had angioplasty or a heart attack or surgery or bypass surgery, if you've got angina, then ideally your LDL cholesterol, which is the bad cholesterol, we say it's the bad cholesterol because it deposits cholesterol in the arteries and contributes to atherosclerosis. Ideally, that should be less than 2, well less than 2 millimoles per liter. That's not always achievable, but that's always the target. And the HDL cholesterol, which is a good one because it does the opposite to LDL, it takes it back from the arteries to the liver. We like that to be greater than 1 if possible. Once again, these targets are not always achievable, but it's certainly a good aim. Cholesterol is only one part of the equation, as with all these risk factors, because we certainly hear people say that someone has a cholesterol of 7 and they live to 90. So yes, because cholesterol is not the full equation, it's just part of it. So if you're prone to heart disease or if you're at risk, then it's certainly, these are the sort of targets we should be aiming for. And diabetes management is also very important. The diabetics in the room will know what HbA1c is. That is basically a reflection of how good your diabetic control has been over the preceding couple of months. And that's something that's also the new way that we diagnose diabetes. So just in conclusion, I think it's very important that everybody knows what their cardiovascular risk is and take steps to minimise their risk by lifestyle factors and medication if necessary. And it's also very important that we recognise any potential symptoms and seek medical attention. All right, thank you.